keeping the microphones turned off, so that way we can have a better connection and we can listen to our guests properly. And also I'd like to say that if at any moment anyone has any questions or wants to make a comment, you can ask them in the chat or you can raise your hand and I shall be attentive to give you the floor, okay? So we're going to be talking today about what's going on after the COVID-19 vaccine and what's coming next for all of us. And for that purpose, we have a very special guest today with us. So before introducing him, we'd love all of you to get informed, to resolve your concerns through our guest. So we invite you to participate in this conversation. So without further ado, I'm glad to invite the new SaludVIP's primary care physician, the Dr. Jason Acosta, who is going to be sharing with us his thoughts about what's next after receiving the COVID-19 vaccine. So doctor, thank you and welcome.
Thank you. All right, so I know a lot of people have questions about what's going on with the world, how the world is going to change after the COVID vaccine and what things are we going to be expected to be going around. But there's going to be a lot of things that people think that they're going to be able to go back to their pre-pandemic lifestyles, but they won't be able to do that right now at this moment, okay? Because even though some people are going to be fortunate enough to actually get the vaccine, it does not mean we can return to our pre-pandemic lifestyle, because at least not yet. There's one thing that we're trying to acquire that's called herd immunity, okay? Herd immunity basically only occurs if a high percentage of the population actually has the vaccine. And currently only 10% of the US actually has the vaccine at this moment. There's still a lot of doubts in a lot of the patients, and some are actually not getting the vaccine for crazy reasons and thoughts about being a microchip being installed in some people and the government trying to control the population and stuff like that. So this is why we want to install better education in our patients so that way we can all get the vaccine and try to get to a world post-COVID, okay? Until then, we're going to have to continue to take our precautions. You know, everybody's going to have to continue taking and wearing their masks, staying 6 feet apart, and depending on certain situations, of course, okay? The CDC is updating every day with new information and different guidelines that we need to actually follow, of course. If we're vaccinated, now I believe they released just recently that we can actually be without our mask in a space that's enclosed if everybody in that room has their vaccination on them, okay? There also could be people that are not vaccinated and they're from the same household, okay? So basically, we're gonna get this updated every day. Everybody has to keep following the guidelines, and the only way this disease can keep on spreading is if there's people that can actually get the disease. So if we get the vaccine, there'll be less people that can be able to spread the disease and we can go back to normal. But the most important part is education. A lot of people are not educated on the material and they're afraid to get the vaccine. And basically they're delaying our change to go back to normal. Okay.
Thank you very much for all the information you're sharing with us, doctor. And I think it's very important because this is a topic that everyone is looking forward to talk about. So we would love to all of our participants to participate in these conversations. So if anyone has questions, have comments, or if you'd like Dr. Jason Acosta to clarify more ideas or to add more information, this is the moment to do it. So to participate, you have two options. You can do it through our chat, or you can raise your hand here in the call and I shall be attentive to give you the floor. And I am already seeing here that we are receiving a couple of questions. And doctor, the first question about this topic is, when we are all vaccinated, when can we go back to normal life and get reunited and attend social events? Or what do you think will happen?
Well, just like I said, you know, even though we're fortunate enough to get the vaccine, it just doesn't mean that we can go back to our pre-pandemic lifestyle, at least not yet. The most important part is trying to get to that herd immunity, okay? If once we acquire that, it depends on the percentage of people that actually get the vaccine. If we can get, I believe the CDC just released that if we can get 2/3 of the population, they believe then we can go to back close to what was normal and get more social events and all that stuff. But we got to take it one step at a time, and we can expect some bumps around the road.
Okay, thank you, doctor. The same person who asked that question is now asking another thing, and it is, after receiving the vaccine, do we have to still wear a face mask?
It all depends. That's a tricky question. Basically, if it's fully vaccinated people that are gathered indoor, they can be there without their mask on. But only if they're with other people that are fully vaccinated, or if they're with people that are unvaccinated and are from the same household, then they can be in that enclosed space. If not, then yes, they have to still wear their mask, especially in public, because when you're in public, you don't know who is vaccinated and who is not. And we're trying to prevent the disease, okay? Trying to not to spread it. Just because you have the vaccine, it protects you, gives you immunity, but does not make you invincible, okay? And you can still spread the disease to others, even if you have asymptomatic disease, okay?
All right. Thank you so much for that answer, doctor. And we were receiving another quick question, and I think it's very interesting, and it is, how long does the vaccine's effect last?
That's a good question, but we still don't have an exact answer for that question, okay? Since these are basically very new vaccines, we don't have the data to show us how long will the vaccine actually protect us, okay? But based on what we know about the coronavirus and mRNA vaccines, we think you may need a booster in the future. We don't know yet when or how often we're going to take these boosters. Experts are working day to day, try to learn about how the natural immunity works about the disease and how the vaccine-induced immunity actually works about the disease. I guess the CDC it's going to keep us and the public informed. But I believe that maybe they're saying just basically a minimum 6 months, we may be able to need a booster, or maybe even a year. So it could be a yearly thing, just like the flu shot.
All right, thank you, doctor. A lot of people is dropping a lot of questions, and I think that's very interesting because this is a topic that we are on top right now. So we have another question, and it is, if I already had COVID, doctor, do I have to get vaccinated or not?
Yes. You should get vaccinated regardless of whether you already had the COVID-19. That's because experts still do not yet know how long actually the immunity lasts. We still don't know how long the protection will last if you just got the disease, okay? Those are the two type of immunities that we're looking for. The one from the vaccine and the one caused by the disease. We're still studying. It's a very new thing. So we still don't know how long it will last. So we're still encouraging all our patients, if you got COVID-19 before in the past, to still get their vaccine, even if you already recovered from the COVID-19. It is possible, although rare, that you could still be infected with the COVID-19 again, okay?
Okay, doctor, thank you so much. We just got another question related with the last one, and it is, doctor, am I at risk if I interact with someone infected, even if I already got vaccinated?
Well, like I said, this is a very new vaccine, and it will protect you against from getting serious disease, and will likely keep you from ever getting the COVID-19 at all. But you could still get about a 5% chance of actually getting the disease. Both Moderna and Pfizer cover for about 95% of immunity. And like I said earlier, it does make you immune, but not invincible. So you still got about 5% chance of getting the disease, but you'll get mild symptoms only, or an asymptomatic infection, which just means that basically you have the disease, no symptom at all, but you can spread it to other people who have not got the vaccine. So that's very important to get the vaccine for everybody.
All right, doctor, that's a very good to know. We have another question that I find really interesting, especially for the people who's assisting to our seminar, and it is, doctor, does the COVID-19 vaccine have side effects if I am taking another kind of medication?
Not really, but there is, the CDC did release some lines that basically if you are taking chronic steroids, they say that you can still continue to take them. But if you're going to restart, just start at this moment, a new steroid injection, to put an example, they're saying to hold off because this can decrease your immunity. So we want you to take the vaccine. And once 2 weeks has passed from taking the vaccine, then you can restart that steroid use or new steroid use, okay? But other thing than that, no medication we believe interacts. And we do not want you guys to also pre-medicate with basically with anti-inflammatories before taking the vaccine, because we've seen that that could cause a little bit of decreasing the effect of the vaccine, and we wanted the full effect. Okay.
All right, doctor, thank you. We have another question, and I think this is precisely good for the context we are on right now. And we are all getting vaccinated right now. And this person wants to know, what precautions should we have after getting vaccinated?
What precautions do we have after getting vaccinated? Well, basically the same as if you didn't get the vaccine at that moment, okay? Because basically these vaccines require 2 weeks to allow the immune system to produce enough antibodies to establish immunity against the disease, okay? And remember that the basic two vaccines that we have in the United States that we're using right now are Pfizer and Moderna. They work with 2 doses. So after the second dose, you have to wait at least 2 weeks before you're actually fully immune and the vaccine is doing full effect, okay? So we're gonna have to actually, during that 2-week period, maintain all the safety and precautions that you're supposed to, wear your mask, 6 feet distance, you know, same precautions if you didn't get the vaccine, so you can actually get it, because you can get sick still in that 2-week period.
All right, doctor, thank you so much for that answer. And we just have received another question that is regarding a situation that is going on right now. And it is, doctor, what are your recommendations if I got the Johnson & Johnson vaccine?
Well, the Johnson & Johnson vaccine has been temporarily placed in a hold in the United States due to some side effects that we've been seeing in some of the population. Usually these are females. Younger females that basically are on anticonceptives have been seeing some clot disorders occurring in their legs and in their brain, but they're very minimal cases. There's about 7 million people vaccinated in the United States with the Johnson & Johnson at this moment. But like I said, they place it on hold. If you did get the Johnson & Johnson recently, we basically tell them just to watch for symptoms, maybe in those 3 weeks of a headache, abdominal pain, maybe some leg pain or shortness of breath. And if you do get that, then seek medical attention as soon as possible with that vaccination, okay? So right now, we just recommend using Pfizer and Moderna until the hold is off, okay?
All right, thank you, doctor. For sure, our attendees are gonna follow your recommendations. And we have here another question that is based on something you already mentioned, and that is, they're saying that we need to get vaccinated once per year. So if so, do we need the same vaccine every single year?
Experts are working, they're working to learn more about the natural immunity, like I said, and the vaccine-induced immunity. So if it's the same or not, and how strong a dose that's going to be, we still don't know, okay? The CDC is working on that. We're going to keep the public informed, and as new evidence becomes available, okay?
All right, thank you, doctor. So I think all of your recommendations give us a context of what do we have to do and what recommendations do we have to follow to go through these situations. And now we are receiving a couple more questions, but they are regarding SaludVIP. So our first question it is, do you know what services does SaludVIP offer?
Well, as patient in SaludVIP, you guys are going to enjoy basically a personal care, okay? That's going to be tailored just for your needs, and you're going to have open access to care 24/7. Your doctor's going to be available here at all times, same day appointments. We got labs in-house. We can do ultrasounds in-house. We have an on-call staff that's going to be available after 5 o'clock. That's going to be able to help you guys with the doctor that's going to be on call. Basically a personalized service where we're going to focus on the patient and maintain them as healthy as possible. Here, we don't try to measure quantity. We actually try to do quality of care and make you guys be as healthy as possible.
Thank you, doctor. For sure, there are services that are going to lead our seniors in the journey towards a better health. Yeah. We have here another question.
Vaccines too. We also provide vaccines too here in our office, and maybe soon we'll be able to provide also the COVID vaccine. All depends on how things go on.
Perfect, doctor. Thank you so much for that. We are receiving another question regarding SaludVIP as well, and it is, what insurances does SaludVIP accept?
Well, basically, we accept all Medicare HMOs, and Medicare Advantage, such as Care Plus, Humana, Freedom, WellCare, Blue Cross Blue Shield, Cigna, Aetna, United, everybody. Everybody that's Medicare Advantage, HMOs, we've been accepted.
Great, doctor. Thank you. Doctor, people are listening to you and all the things you're saying about COVID, about the services in SaludVIP, and there's a person who's asking, Doctor, in case I want to schedule an appointment with you, what do I have to do?
Or you just can call us at 352-432-8989. And, you know, we're here, we're open 24/7. We're here, and you can call us, schedule. We're currently open for new patients. All you guys got to do, just give us a call.
Great, great. Just give us a call. All right. Thank you, Doctor, for all of your answers and for all of your recommendations. And I'm sure that all of our attendees are going to follow it and are going to recommend it to other people who may need it. But unfortunately, our time is up. And consequently, I'd like to thank the Dr. Jason Acosta for all the information you shared with us today. And of course, I want to thank to all of you for your attendance to this version of SaludVIP Cafe. Also, I want you to remember that you can get in contact with us through our social media profiles. Don't forget that we are present on Facebook and Instagram as SaludVIP Florida. And you can also write us an email at info@saludvip.com. There we go again, info@saludvip.com. Before we leave, I want to say something, and is if any of our attendees found this information practical or useful for someone you know, invite that person over, share this link with them, let them know we're having this kind of conversations, and that way we can reach more people and we can encourage them to join us in the journey towards a better health. Also, we would love you to stay tuned to our communication channels, and that way you can attend the next seminars, the next versions of SaludVIP Cafe, to get informed about many topics and listen to the recommendations of our guests. So if you'd like to get noticed, leave us your name, your phone number, and your email here in Zoom or in the comments box below, and we will be in contact with you. So that being said, we wish you a happy rest Thursday, and remember that prevention is the beginning of wellness and a better health. I hope to see you in the next version of the SaludVIP Cafe, and I hope to see you in the next time. Bye-bye.